Good morning. Could you please confirm your team number?
507.
507. Thank you, Team 507, and welcome to Washington, D.C. And congratulations on making it to the final round of the Fiscal Challenge. My name is Phil Smith, and I'm the National Field Director for the nonpartisan Concord Coalition, and I'm pleased to be your Emcee for today's competition. I thought it might be best if I read the rules to you one final time. I know you know them, but hopefully this will really make you realize everything you're in for. So you will have 15 minutes to present your plan. Those 15 minutes will include any time you wish to allocate to introductions. The judges will not ask questions during these 15 minutes. I will alert you when I start the timer. I will alert you when you have 5 minutes to go, 1 minute to go, and when the time is up. I will be curt when the time is up and stop you mid-sentence. We will then transition to Q&A. You will have 15 minutes to field and address questions from the judges. If your team is answering a question when the time is called, I will let the person answering the question complete their thought. However, they may not switch to other thoughts, nor may other students contribute to the answer. Questions can include how you have incorporated recent events or releases that have occurred since your first round proposal. At no time during your presentation or Q&A should you reveal your individual names or school affiliation. You may only reveal your team number. Faculty advisors may be in the audience for both presentation and Q&A, but may not participate. Once your team has finished, you may join the audience to watch other teams. You may now begin, and when you're ready, I will start the timer when you start speaking.
This is Team 507's solution to a sustainable future. Rising debt slows economic growth as it increases the cost of borrowing when investors lose faith in our ability to pay back. Also, there's a crowding out effect of private investment as the government competes with the private sector for limited resources. Running high deficits, as we will see is the case in the U.S. in the upcoming slides, adds to the debt levels, which balloons net interest expense. These factors can create a debt spiral as more debt needs to be issued to pay off the current maturing debt, leading to larger future interest expenses. The U.S. federal government continues to run high deficits projected to reach 6% of GDP by 2035 and is expected to grow. Projected spending by category shows mandatory spending and net interest expense growing and being the primary cause of the high borrowing. Additionally, revenues are expected to experience low growth relative to spending. As a result, debt held by the public is projected to reach 156% by 2055, levels not seen since World War II and the pandemic. One of the reasons debt has risen in the U.S. is due to the ratio of working-age adults to older adults decreasing from 6 in the 1950s to just 2 by 2055. This has negatively impacted pay-as-you-go mandatory spending programs like Social Security and Medicare. Next, rising life expectancy has also placed a larger burden on these programs, as those receiving benefits are receiving benefits for longer. And lastly, interest payments are a growing expense, and in 2025 alone, over $9 trillion of debt will need to be refinanced. Economic research at Cato in 2021 compared 17 research papers and concluded a debt level above 90% GDP threshold hinders long-term economic growth. Each year since 2021, CBO's 30-year debt projections has decreased from 201% in 2021 to 156% in 2025. Given the reduction in recent projections, coupled with strong economic metrics like low unemployment and inflation nearing the Fed's target, we feel that the economy is strong enough for us to target a 90% debt ratio. This allows us to make key investments in the economy and improve existing programs to ensure a better future. Our race to 90% begins with reforming current programs, followed by adopting new policies, creating economic growth, and eliminating inefficiencies. Follow our journey, illustrated with a lap around a track, as we reform, adopt, create, and eliminate policies and programs to achieve our goal of 90% debt to GDP by 2055.
The first phase of our proposal involves reforming current policies such as Social Security, Medicare, healthcare, and tax. Reforming these policies will help them keep up with economic and demographic changes and would reduce the overall debt to GDP by 12.3 percentage points. Our first policy reforms Social Security by raising the full retirement age by 2 months per birth year for workers born between 1964 and 1981. And for all workers born after 1981, the FRA would be 70. This will allow more time for the younger population to plan for their retirement while not burdening the ones that are closer to retirement. When payroll taxes for Social Security were first collected in 1937, about 92% of earnings were below the maximum taxable amount. Amendments in 1977 increased the maximum taxable share, but have not kept up with earnings growth for the highest paid workers, which were about 83% of earnings in 2020. This policy will increase the maximum taxable earnings to $305,100 to include 90% of earnings in 2026, which will then be indexed to average wages after 2026. This will ensure fair contributions from all income groups, and these policies would decrease the debt to GDP to 151%.
The U.S. has experienced the highest growth rate in health spending as a percent of GDP relative to all other developed economies. This, coupled with a growing older population that has the highest share of health spending, makes it necessary for us to reform healthcare. Like our Social Security policy of eligibility age, we propose raising the Medicare eligibility age from 65 to 67. It would increase by 2 months per year and reach 67 for those retiring in 2036. Our second policy would allow Medicare beneficiaries to choose from insurance plans offered by private insurers for Medicare Part B while the government shared the cost of the premiums. Private health insurers would submit bids to provide these services, and the average bid would become the benchmark for that region. For plans offered at this benchmark, patients would pay standard premiums while the federal government would pay the remaining amount. This premium would cover about 25% of insured expenses covered by Medicare Part B. These policies would reduce the debt to GDP ratio to 145%. Competition within the healthcare system is an important factor in controlling prices and quality of care. However, based on DOJ and FTC guidelines, 80% of hospital markets are considered to be highly concentrated. This limits consumer choice within the market, and studies show that patient health outcomes decline in concentrated markets. As shown on the graph, based on a Harvard study conducted on 246 hospitals acquired using Medicare's Hospital Consumer Assessment Survey, quality of care did not increase following consolidation, and patient experiences declined. Our first implementation would increase funding to the DOJ and FTC by 33%. Currently, reported mergers are up by 57%, while inflation-adjusted funding has fallen by 12%. We hope that these added funds would allow them to increase supervision within the healthcare sector. Next, we would amend the Federal Trade Commission Act to allow action against anti-competitive conduct for not-for-profit firms, a category in which most U.S. hospitals fall, and shift the burden of proof to defendants in antitrust cases. Finally, there are currently no reporting requirements for small mergers, which are mergers under $50 million, and we believe implementing requirements for this would result in greater supervision. In order to cover the higher operational costs of hospitals, Medicare pays higher fees for procedures done in hospital outpatient departments than for the same care in physicians' offices, leading to an increase in vertical integration. Our policy of site-neutral billing would remove facility fees charged at hospital outpatient departments. These antitrust policies, coupled with site-neutral billing, make healthcare pricing more competitive and reduce the debt-to-GDP ratio to 144%.
Our first tax policy reforms unemployment tax by raising the effective federal unemployment tax for employers from 0.6% to 0.8%, by reducing the tax credits from 5.4% to 5.2%. This additional revenue could help those that are structurally unemployed due to automation and AI. This policy brings the debt to GDP ratio to 143%.
The next stretch in our race to 90% involves adopting new policies to reduce the debt-to-GDP ratio. We would adopt changes to the current healthcare system in order to reduce outlays by improving efficiency and adopt a public spectrum auction. These changes would reduce the debt-to-GDP ratio by 2.99% or 9 percentage points. First, research demonstrates that the adoption of health IT significantly increases efficiency and reduces errors. Its implementation streamlines administrative tasks like paperwork and billing, lowering costs. Further, electronic health record systems, which are comprehensive records of a patient's medical history, including details such as demographics, test results, and prescribed medications, centralize data such that it is easily accessible and secure, preventing medication errors and unnecessary tests, both lowering costs and improving quality of care. Our next policy would mandate upfront pricing throughout the healthcare system. It would prohibit the use of price estimates and ensure employers receive detailed claims data to manage overbilling and make more informed health plan decisions. This policy would foster competition within the healthcare system, reduce the problem of asymmetric information, protect patients from surprise medical bills, and eliminate costly inefficiencies by allowing consumers to shop for the healthcare that best suits their needs. Together, they reduce the debt-to-GDP ratio to 141%.
We propose a new policy to auction off public broadcast spectrum licenses. Currently, these licenses are given out by the FCC for free, but under our proposal, we will auction off larger licenses every 20 years and smaller regional licenses every 10 years. GDP impact was not calculated but can be estimated to be positive due to innovative use and efficient allocation of these licenses. This policy brings debt to GDP to 140%.
The next stretch in our race involves creating new policies to lower the debt to GDP ratio by bolstering immigration, education, and infrastructure. These policies will reduce debt to GDP by 18.5 percentage points. According to the CBO, U.S. net population growth with current immigration policies will reach 0% by 2050. We must rely on immigration to enhance a more productive workforce. We propose to reform the H-1B and H-2A visa programs. We would increase H-1B visas to 115,000 and exempt foreign-born graduates from U.S. universities from this cap, which will attract more skilled workers from around the world. Industries such as healthcare and technology are facing a shortage of workers, and this can help to fix that problem. We will combine this with adding a cap to the H-2A visa program of 110,000 visas for temporary non-native agricultural workers. This would reduce reliance on undocumented workers, and the visa would be valid for up to 3 months with one renewal and offers job security for lower income workers. These combined would bring debt to GDP to 124%. The U.S. is currently lagging compared to other countries when it comes to K-12 education. The graph shows adults ages 16 to 65 literacy and math scores, which are converted to standard deviation for a common scale. As we can see, these scores have been rapidly declining. Our policy will target children at an early age by providing universal preschool, boosting GDP in the long run, and enhancing human capital. This policy is providing free universal preschool to children all ages 3 or 4 years old, regardless of their economic background. It will increase costs for the government, but will also increase GDP in the long run when the educated youth are able to join the workforce. According to research done at the Brookings Institute, students enrolled in high-quality preschool are more likely to have higher labor productivity. Universal preschool would cost the government $1 trillion, but would boost GDP by 0.88% by 2050, and bring debt to GDP to 128%.
To create economic growth in a sustainable future, we need to double our energy grid capacity by 2055. To get there, we will invest $2.43 trillion over the next 30 years amongst different sources. In the short term, most spending will be natural gas, but later spending will be strictly renewable energy. We will invest in multiple energy sources in order to not stress one individual industry. To complement our energy investment, we propose a 10-year rural internet subsidy program that will provide 10 million satellite units to areas in need. We will provide one-time purchase credits for customers and monthly use rates of $20 per unit. The 10-year cost of our plan is $123 billion, but will create long-run GDP gains due to improvements in education, social connectivity, and productivity. These policies bring debt to GDP to 125%.
The fourth and final phase of our proposal will eliminate inefficiencies within the current systems. Eliminating inefficiencies will strengthen fiscal sustainability, efficiency, and simplify the overall structure within each system, and will reduce the debt to GDP by 32.5 percentage points. Our final Social Security policy is targeted towards eliminating an inefficient way to calculate benefits. Currently, Social Security benefits are calculated by applying a progressive formula to average lifetime earnings. For all newly eligible beneficiaries, our proposal would be set to 125% of the federal poverty level and adjust the FPL using the CPI or real wages. Replacing the current system with a uniform benefit would improve economic efficiency by simplifying the benefit structure. Additionally, it ensures a basic income level for all retirees, helping those at lower income levels while helping control long-term program costs. This policy would decrease the debt to GDP to 119%.
We propose imposing a 5% value-added tax on a broad basic goods and services. That is a more fair and efficient system and incentivizes savings, as is evident by how many countries have adopted it, which is shown in green on the graph. To balance the burden on consumers, we'll pair that with lowering the income tax by increasing allowances, which will replace the standard deduction and personal exemptions. Implementing these changes will allow for less discrepancy in the tax code. Our next policy is to add a carbon tax. Pollution is a pressing issue against the fight against climate change. Specifically in the U.S., since 2021, the United States per person carbon dioxide emissions were twice as large as China's and nearly 8 times as large as India's, reaching over 400 billion tons of CO2 emissions. Given the negative externality from pollution, a tax will correct the market price. A carbon tax proposal is supported by over 3,500 economists, including 4 Fed chairs, 28 Nobel laureates, and 15 former chairs of the as part of the Council of Economic Advisors as part of the Climate Leadership Council. We do that by implementing a carbon tax at $25 per metric ton of carbon dioxide emissions, which would increase 5% year over year. bringing the debt-to-GDP ratio to 97%. Our final tax proposal is to eliminate itemized deductions, which unfairly gives benefits to certain categories of spending. In 2020, only 10% of filers utilized itemized deductions, and 80% of those resulted from the three largest categories: state and local taxes, mortgage interest, and charitable contributions. Eliminating these would increase the tax rates for higher income taxpayers more than the lower income taxpayers, complementing our VAT policy, bringing the debt-to-GDP ratio to 91%.
The Jones Act was passed over 100 years ago as a federal law that regulates the transportation of cargo between U.S. ports and coastal waters. The act says that all cargo must be carried by U.S.-built, U.S.-owned, and U.S.-operated vessels. This outdated law substantially hurts our supply chain potential. Eliminating the Jones Act brings debt to GDP to 90%. Team 507's policies successfully completed the race to 90%, and we can see the impact of each category on debt. First, by reforming current programs by 12.3 percentage points, then adopting new policies by 2.9 percentage points, creating economic growth by 18.5 percentage points, and finally, eliminating inefficiencies by 33.5 percentage points. The political support of our policies are shown here, starting with Democratic support on the left, bipartisan in the middle, and Republican support on the right. Finally, we are confident in our solution as is shown by the 95% confidence interval. Thank you from Team 507.
Thank you, Team 507. It is now time to transition to our Q&A session. We now turn it over to our esteemed panel of judges.
So I'll start us off, and just from that last slide. So you expressed that as a confidence interval, which makes me think you have a sense of what your standard errors are. How did you decide what the errors were to know that that was a 95% confidence interval?
That is a good question. That part of it I'm a little unsure of based on we did it a little while ago, but a part of that confidence interval really falls into the short-term volatility of like the current administration's policies, like regarding the tariffs. So that's where if the tariffs become enacted or not enacted, our policy, we have enough, or our proposal has enough room for error there. And in regards to tariffs, in case there's a future question, we don't expect them to be permanent. However, we also targeted 90% because we know GDP will naturally decrease slightly. And so we have another 5% room in order to reach our goal of 95.
So I think the largest effect you had was for some of your tax policies, the VAT and the carbon tax. Can you talk about how you chose those and what you think the political viability is of those taxes becoming a part of U.S. policy?
Yes. Firstly, we know that VAT is a much different system that we use here in the United States, but pairing those with our four tax policies cumulatively together, we expect for those to, like I said, allow for less discrepancy in the tax code, and also fostering those changes that will increase, will actually lower the debt to GDP ratio in the next 30 years. And also for the value-added tax, having the family allowances to not overburden the consumer as well, because those are four key tax policies that we have enacted on our proposal.
I'm thrilled to see this kind of summary slide. I really appreciate that, including a breakdown of the revenue, the costs, and the GDP. But that being said, one of the pieces that you have, how you structured this with breaking it into reform, adopt, create, and eliminate, you had things related to Social Security and things related to healthcare in multiple categories. And so I'm just wondering how you thought about estimating how those policies would interact with each other. For example, you have healthcare pricing transparency while doing site-neutral payment reform. So did that impact, did that increase or decrease the score of the other one or anything like that?
Yeah, so I think with most of what I was trying to accomplish with the healthcare policies was to increase competition within the healthcare system, and I think a lot of our policies do relate to that concept, because I know that 2 of our main healthcare policies have somewhat of a negative impact on consumers just due to reducing outlays. So I think we tried to couple those policies kind of in separate categories just to, based on their relationship to each other. And again, most of our healthcare policies were aimed at trying to reduce competition within the healthcare system.
Let me rephrase that question. So when we go about this exercise to determine what the budget impact of something is, some of these policy changes can impact what the budgetary impact of another policy change is. So I was just wondering how you accounted for that, or how you thought about that when you were modeling it. So not the category piece of it, but the actual budget number.
I understand. Yeah,
calculations.
thank you for, so I think to answer your question, site neutral billing will reduce the amount of money hospital outpatient departments receive, which would make it more difficult to then enact hospital information sharing. Is that correct, kind of what you were asking? Or,
That is, you're now going in the right direction.
yeah, okay.
What I was asking, yes.
Yeah, and I definitely think we accounted for that in that some of our antitrust reforms and site neutral billing, there was kind of a percentage, a range of what the impact of those things could be, and we tried to look in the lower end of that, just in hopes that the funding would not be as decreased to these hospitals, and considering what we would need to then enact our other policies.
Thank you.
So building on the healthcare questions, sorry to put you on the spot, continued, but there's a lot more health policies than Medicare, and you touched on some of them. I was curious what you've thought about Affordable Care Act, premium tax credits, about Medicaid, about the employer exclusion, and whether those are incorporated into your numbers and I've just missed it perhaps.
These were not incorporated into our numbers. I appreciate you asking. That's something we definitely should have done more research into.
I want to ask about distributional effects. Did you think about maybe I want to ask 2 questions. I want to ask about distributional effects. Did you think about who is going to benefit most? And then perhaps also about trade-offs, where there were negative effects and positive effects. So I appreciate those are sort of related questions. So however you want to take it is fine with me.
I think in terms of the distribution effects, you see a common theme in a lot of our policies where we're really trying to lessen the burden on the lower income consumers, and really a lot of the pressure becomes on the higher end. So in terms of the tax policies, you see that's why we increase the allowances for lower income people. Naturally, that will just help create more distribution to the lower end, which they are also the majority of the consumers. So when they have more purchasing power, you can expect an increase in GDP growth as well.
So stepping outside individual policies, which are very interesting, and I'm sure we'll have more questions on that, I wanted to ask more broadly how your team approached this project. How did you divide up the work, decide what to focus on, and how to structure your deficit reduction?
Yes, so when we first saw this opportunity to compete in this competition, we were really excited. We're competing obviously with our 6 here. And we took this advantage to, show that we can do the hard work and know the political backing and our policies well enough to come here and compete in DC. I would say that we took this all in our own individual ways, but still culminatively working towards our goal of getting here and performing in front of you all today. We took our individual interests, which might show up later in the networking, specific organizations. With me starting with tax, and then fellow colleague here, healthcare, Medicare, and then the intro and some of our other infrastructure ideas. We took those on by what we really wanted to study and learn more about, and I think that's reflected in our data and our responses. This is something that we really enjoy doing, and hopefully it's reflected that today.
I think building off of that, in terms of a lot of our GDP policies, when we first began research, we really looked at where do we find inefficiencies? Where is there room to improve current policy? And that's where we really started. our research, and then we kind of ventured out. We threw a lot of things at the wall. Some stuck, some didn't, but we ended with the stuff that stuck. So it was kind of a fun process of just going out very broad and then ending very narrow.
Could you talk a little bit about how you thought about the political viability of different proposals and what you packaged together to try to offset where one thing might lean one way, something else leans another way?
Could you repeat the question, please? Sorry.
Yeah, I'd just like to know your thought process on how you went about thinking through which pieces might appeal to some people more than others and how you might offset that with others.
I think we definitely tried to focus on policies that, even if they're more leaning to one side, have some bipartisan support already. And as you can see, we do have primarily bipartisan policies. And I think that was definitely, while some of the immigration acts may be more leaning one way or another, we were able to find policies supported by both sides for a lot of our policies.
I have a question about the unemployment policy. It went by very fast, but it looked like there was something in there about people who lost their jobs due to AI.
Yes, ma'am.
What the heck is that?
Yes, so that is from a study that is going to be conducted from 2023 to 2033. We're expecting a drop-off, especially for impacts in software developers and financial advisors, respectively 17.9 for software developers and then 17.1 for financial advisors, and the overall impact specifically in architecture and engineering to be 6.8%. So that is why we have added that policy to help offset those who are structurally unemployed during that time due to automation.
What is the policy?
So it's actually raising the tax credit to help pay for the people that are now going to be unemployed due to automation AI, with the expectation that AI is going to improve over the next 10 years to offset the loss of jobs during that period.
So it's not, I'm just following up because I used to be an unemployment analyst at CBO.
Yes, ma'am.
So is there a specific program that would reach out to those workers affected by AI and provide them, retraining, or are you just anticipating more unemployment because of AI?
We're just anticipating more unemployment due to AI, just because of the rapid increase and sudden changes in our labor market.
I think building off of that, to clarify, this is a temporary policy, but historically speaking, every revolution has added more jobs than it loses. So that's why this temporary policy is meant to just be temporary, and then the future gains of AI should, historically speaking, add more jobs than it loses. So that's why this is kind of a bridge between now and the future.
Since we're talking about time, so please, if you bear with me, assume we go into a recession tomorrow. Is there anything that you would change in the timing of how you would implement your policies if you knew we were going right into a recession?
No, I don't think so, because we're looking at a timeline of 30 years. So we are expecting certain things, especially cyclical things like a recession, to not be permanent. And same thing goes with the tariffs. We're not expecting things like that to be permanent. And so I think we're safe, especially with our 95% confidence interval, that we're in a good place with our policies.
I feel like going off of what he said, immigration could be sped up that process and we could even add more visas. I think that could help during a recession to get more people in the workforce.
Could you actually go back to the immigration slide? You guys covered a lot, it was great.
This one specifically?
Yes.
So what are you estimating for the overall increase in the immigration population?
We did not get to an exact number, but if we were to increase the H-1B cap, which would be graduates from U.S. universities, that would probably add a lot more immigrants into our workforce, just because when they come here for college and to get their education, they can get their visa to stay here. So I think that would be a pretty big increase. To address the H-2A, I think it would be a big increase, but it is mostly just to help with undocumented workers.
Okay, actually, that was my next question. So this is about legal pathways, and kind of embedded in that, there is legalization of people that are currently undocumented.
Yes.
What did you consider the viability of the antitrust proposals?
I think given the current situation right now, it is less viable given cuts in spending. However, we did, as I mentioned earlier, err on the side of caution with those policies and went with a lower percent impact when forecasting them. I also do think there is political support on both sides for an increase in antitrust policies. It's just to the percent that funding is able to be given.
Are you about to put up the 1 minute? Great. I want to end where we started, which was putting different policies in different buckets. And I think, if I remember correctly, you're leveling out Social Security benefits to, I think you were basically capping Social Security benefits at some level, some ratio to the poverty level. You characterize that as fixing an inefficiency. And I wondered, what was your motivation for putting that under inefficiencies and not just characterizing it as a benefit cut?
Go back.
Yep.
Yep.
Come on,
Yeah.
So with this policy, the rationale for placing it in this bucket, so to speak, is because I saw it as capping it and basically helping the lower income groups. And basically the way they calculate benefits now, it's very complex. And I thought maybe doing my research, setting it to the federal 125% above the federal poverty level would be, it's just a simpler way. It's just, basically that's what I'm saying, is it's a simpler way to calculate benefits, and basically saying it's an inefficiency, the current system is an inefficiency, that's sort of subjective to the opinion I got from my research.
Team 507, your time has expired. Thank you so much for your presentation.
Thank you.